All right, I'm here with Kellsi Frye. Thanks for joining us on these community conversations. Hi, Kellsi.
Hi, how are you?
Good. Kellsi, you're a registered nurse, and nurses are our heroes all the time, but certainly during these days, healthcare providers are on the front lines of so much of what we're dealing with today. But before we get into all that, just tell us a little bit about yourself, your wonderful husband, and family.
Yeah, so I'm a registered nurse. I've been a registered nurse for about 11 years. I live here in Mount Juliet and work in Middle Tennessee. I've also been married for 11 years. My husband, Colby, he does home improvement, so not in healthcare. We have one 7-year-old daughter, and then we're also foster parents. So we have kiddos in and out all the
Yeah.
time. Keeps life really exciting. So I work for a national, large insurance company. We operate all over the United States as well as internationally. And the kind of branch of the organization that I work for is our government business. So Medicare, Medicaid, we care for our most vulnerable population. So elderly, disabled, chronically ill. And then my team works in collaboration with hospitals across Tennessee. As patients go into the hospital, we are involved in collaboration there, coordinating their care, making sure that they have everything they need when they're ready to go home or to the next level of care. So I work really closely with hospitals all across the state.
Yeah.
So yeah,
Well,
not on the front line anymore, but
yeah, well, it's important work and it provides some great insight for us as we think about what the coronavirus means for us day to day. Obviously, there's national news, global news that
mhm,
we're watching every day, and news reports and so on. But just like all politics is local, they say, all these healthcare issues and the way that these things affect our lives are very, very personal. They're not just in some
absolutely.
faraway place at this point. So I just thought it would be good on this episode of Community Conversations to talk to someone that a friend of mine and someone that's in healthcare and understands kind of the landscape for us. And so thanks for being with us.
Of course, glad to help.
Yeah. And also on another, we'll have to have another conversation later about foster care and
Yeah,
just how God's been using you and Colby in that way, and how other folks can maybe be a part of that as the Lord would lead them. But just full disclosure, Kelsey's a part of Green Hill Church, and Kelsey and Colby and their family, and so we've known them for a good while. But well, talk to me first, and talk to us first about just the magnitude of what we're dealing with. A lot of us, I think, maybe a month ago, maybe 5 weeks ago now, were a bit dismissive about the whole issue. Why do you think we were caught off guard? Why do you think things ramped up so quickly? At least from our perspective, they ramped up quickly.
yeah. So my perspective is a little different because I'm in healthcare. So I feel like we kind of got a, a big jump. But it is, I think anything that starts kind of, you alluded to in a faraway land, it's kind of far off, it's really distant from us. And some of that I think we can attribute to our American culture. But I think it seemed to be impacting so far away that it wasn't really hitting close to home for a lot of us. And the nature of this virus, it just seems to spread very quickly. We're still learning about how it spreads from person to person. And so once it got here, it was here. And we're seeing that spread kind of take place here in the United States now. But I think with it being so far away, we were able to just kind of distance ourselves or ourselves. And now that it's here, it's definitely, the impact is definitely being felt, especially in areas like you see New York City, where the population is really concentrated and people are really close together. Um, that's kind of optimal prime virus spreading environment.
Yeah, absolutely.
Yeah.
You talk about relating to hospitals across the state of Tennessee,
Mhm.
and that's where we're located. If
Yes.
somebody happens to find this in a faraway land, we're in actually in the middle part of the state of Tennessee in the United States. But you're working with hospitals across our state. What are you finding today that may be a little different than a week ago, even?
It's very different. It's a very different landscape. So what's the same is that the healthcare providers are showing up every day to work ready to provide high quality care, right? And that's what's important. What is a little bit different is that we're seeing all the hospitals really begin to, and they did a while ago, like you mentioned, kind of about 5 weeks ago, probably. And some even before that. I mean, they had, and I don't work in those hospitals, so I don't want to speak for them, but in the conversations that I've had with them, um, they were preparing as soon as they knew that the possibility that, that this virus could make it to America. So what we are seeing is things that people may go to the hospital for that are not so urgent or emergent are being put off. So things like elective surgeries, like things that you can do next month or next fall if you needed to. So like total knee replacements and stuff like that. Those are being put off as much as they can to make room for a potential influx of patients. And we are seeing patients begin to come in, although not to the degree that we had anticipated so far, which is great news because it means that people are following, those practices that have been put in place to help keep us safe.
Yeah. You mentioned the vulnerable population, the elderly, those that don't have as much access to health care. What are we seeing in that among that population?
Um, so one of the things that has been really encouraging to me as a nurse and a Christ follower is that people are really concerned about the vulnerable population, right? So they're always here. The elderly and the chronically ill are always around us, but there's kind of a heightened awareness of their presence in our lives and in our communities. And so what we're really seeing, and I'm seeing this not just as a nurse, but as a neighbor and as a boss. I have a team of nurses. Everyone is really going above and beyond to protect those people. So, whether that means helping with things that they need, getting things delivered to them, or simply distancing themselves from grandma or their uncle who has a chronic disease. We're really seeing that practice being put into place. We are seeing, that the virus does make its way to some of these vulnerable populations, especially here in Middle Tennessee. Just recently, we've seen a nursing home. And this is not from my work, this is just from the news
Sure.
knowledge that we've seen from credible news sources about a nursing home that was affected here locally. And so we are seeing the virus begin to um, take a toll on those populations. But I think that makes it all the more important that our behaviors reflect that social responsibility of protecting those populations as much as we can.
Yeah. And I know before we came on, I mentioned that kind of the end game of these conversations are to help us learn how to, just love our neighbor more effectively. And uh, Jesus is uh, our Redeemer, but He's also a model for us, and He taught us what loving neighbor looks like. And and obviously part of the great commandments to love God and to love others. And so we really want to put that into practice. And this seems like a wonderful opportunity for people who follow Christ and care for their neighbors to really put some of these things in practice. What are some, and you mentioned some ways already, but what are you seeing, and what are some ways that we can be just mindful? Because a lot of us who are relatively healthy, at least we think we are, um, we may minimize the threat. And I know I can be guilty of that, and others, just because it's not right on me, but or I don't know that it's on me. So we just have this illusion that we're pretty healthy. But how can we raise our sensitivity and then just change some of our habits of life that in a way that would really communicate love for neighbor?
Absolutely. And just to echo kind of your point, I always heard this saying that the enemy of enthusiasm is time, right? And so we've been in this now, we've talked about a couple times, 4 to 5 weeks. And so one of the things that we are kind of starting to see are people are getting a little antsy, right? It's
Yeah.
really pretty outside. And so people are kind of feeling that itch to get out of the house. So I think that the number one thing that we can do for the vulnerable populations always is going to be prayer, right? Covering those
Mm.
in our circle and even outside of our circle. in prayer, and that the just asking that the Lord will protect them and keep them safe, help them to be at peace. I know I have two grandmas who are young, very young, but praying constantly that that God will give them a peace as they're kind of locked away. So that's
Mm.
new for them too. And so being at home can be difficult, for those populations as well. So definitely prayer, and then to do the things that you're hearing on the news, right? So stay home unless what you need to do is essential. And by essential, we don't mean like gardening. So we mean like food, shelter, medical care, things like that that are essential to your life. And I understand there's argument for essential to sanity, but essential to your life at this point, even though you might be kind of getting that itch to get out and about. So definitely doing that. If you're sick, then absolutely staying home, and isolating yourself, sometimes even from the loved ones that are really close. Maintaining a distance when you are out and about in the community. I know everybody's heard that 6 feet rule. So staying 6 feet away, covering our coughs and our sneezes, and then washing your hands. Just, we can't, you won't ever hear a healthcare provider overemphasize washing your hands. So
Yeah.
very, very important.
Yeah. I've been feeling like a surgeon. I just
Yeah.
walk around,
Yep.
washing my hands and going outdoors backwards, just
That's
so
right.
I'm trying to do the right
That's
thing.
right.
But yeah, I appreciate all of that. I think the way
Yeah.
that we look at people, the way we view people, and see them as image bearers, worthy of our respect and and worthy of honor, compels us to, like you said, pray and then treat them the way we want to be treated
Yeah.
if we were vulnerable, and because we really are, we just
We
may
are.
not always know that.
We are.
Well, talk to us a little bit. Well, I'd love to get your take on the future. I was in meetings today, and this may air in a few days from the time that we're talking. But I was in a meeting earlier today, and other meetings yesterday. Almost every day, we're kind of trying to speculate of how long we'll be in this quarantine, safer at home era. And I know nobody knows that exactly, but as you think about that, what are you and your family preparing for as we look at the weeks ahead?
Yeah. So, um, not to repeat you, but
No, it's okay.
but it is really, really hard to speculate, right? Even as a healthcare provider, we talked about it in the beginning that we still don't really know how the virus is spreading. There's a lot of things that we still really just don't know.
Mm,
That's one of the things about this being such a new or novel virus, is that there's so much unknown. So we don't know, if this is going to be a wave that will just come in and then go away, or if this is going to be a new bug that will hang around kind of like the flu and have peaks in the winter and go away in the summer. We don't know.
mm,
There are some credible sources out there that are really, really looking into that, and trying to learn as much as they can. As for my family, we are, and you talked about it before, settling into some new habits.
mm-hmm.
I think was the phrase that you used, and I really, really like that. We are planning. I've told my husband I feel like this is probably not going to end in the foreseeable, month or so. We are preparing to at least be inside, or socially distanced through April. And then we really just don't know what will happen after that. But I think it presents a really great opportunity, as we talked about a little bit before, to learn new habits of how to be a really good neighbor. So we have, I know it sounds kind of old fashioned, but we've gone back to some older things like, playing outside and calling our family members really frequently, especially the vulnerable ones, to check in. So
Yeah.
we call the grandmas twice a week, do you need anything? And just learning how to love kind of from a distance. One of the other things we did this week, um, and this wasn't in your question, but it's fun to
That's
share.
great.
So one of the things that we did this week, we called them porch drops. We went while we were at the grocery store getting essential food. We also picked up some flowers, and then we put them in just some little springy containers and dropped them on front porches. So no contact with their home, just literally setting them on front porches and then texting or calling to let them know that there was something outside. So that was really fun. And I
That's
think that
awesome.
it's really been a great way to learn and to teach our kids, how to do something a little bit differently, and how to show love from a distance, what that looks
Yeah.
like.
That's so good. What do you call that? What'd you call
We
that?
just called it porch drops. We were like, we
Porch
just did
drops.
some,
Yeah.
yeah, some porch drops.
That's
There's probably
awesome.
a better term for it, but
Well, I think, and just to ping off this, and I know you can't predict the future and all of that, but there are concerns that we'll get through this, but then we'll get back together, and then there'll be a second wave. How do you see healthcare providers thinking about that, and then in light of also perhaps a mitigating, vaccine, or some sort of breakthrough in terms of treatment? How do you see all that working, or what's the conversation like in healthcare circles about the possibilities of that?
yeah, I think that healthcare providers are playing a long-term game. I think that they are preparing for this could be around for a while, and we need to make sure that that we are prepared. The CDC has fantastic guidelines out there for hospitals and nursing homes, doctors' offices. Their website is really a wealth of information, and the healthcare providers that I work with are really taking that to heart. They're taking it very seriously,
Mhm.
and they are preparing, to maintain that, to continue to provide high quality care, to continue their best practices of infection control and the things that are really already in place. They are planning to maintain that, and I think the healthcare provider circle is just so tight. It's such a tight knit
Hmm.
team, and it's not just doctors and nurses, right? So we've got respiratory therapists and occupational physical speech therapists. I mean, all the way down, we've got housekeeping and food services, and everyone is really doing their part to the best of their ability. In the conversations that I'm having, they really are a united team, and they're really approaching this in that fashion. We're taking on COVID-19, and we're gonna do everything we can to keep our communities safe and
Yeah.
healthy.
It means so much. It really
Yeah,
does. And we've we always have high esteem for healthcare workers, and along with first responders and folks that
absolutely.
that are serving us at such a high level in such often a dangerous climate. And many times we don't recognize. We do now, but in the day to day, we've not always recognized how vulnerable of a place that puts healthcare providers as they're serving us in ERs and other healthcare facilities. You have a young daughter, Kylie, and so as a mom, as a nurse, how should we just, and as a Christ follower, what what are some best practices that you've seen in terms of how we talk to our kids about this, and how we help shepherd their hearts through this kind of season that is really going to be, I think we all feel like this is a turning point in this generation. It may not be the World War II scale of violence and so on, but certainly it is a game changer for this generation. What are your thoughts, just as a mom and a nurse, as you're shepherding the heart of your daughter?
Yeah, that's a great question. And I'm happy to answer it because it's definitely something that we've considered very prayerfully, and um, obviously something that we take very seriously. But we come very much from a parenting approach that, as transparent as we can be with her safely, we want to be as transparent as we can.
That's good.
So even at 7, it's not good for her to be kept inside and not know why, right? So we have pretty open conversations. She knows the term coronavirus. It probably helps that mom is a nurse, but um, we so we talk pretty openly about that, right? We talk about how it spreads, and
Mm,
how it can impact those around us. We've talked openly about how our grandmas are really vulnerable, and that it's very important, because she doesn't understand, right, why we can't go see grandma and great grandma and
yeah.
everyone else. So really taking those teachable moments to say, this is why. How can we love grandma from far away? Or how can we show love to our cousin and our school classmates and our neighbors from far away? Because it's important, first and foremost, not that you're having fun, but that they're safe, right? And
Yeah.
that they have what they need. And so I think always, um, that's really a big thing in our family too, is helping her to understand that she is not the center of the universe. And that's a
Yeah.
parenting challenge in the 21st century. But
Yeah.
I think that this presents I don't want to make light of it, but I think that what we're seeing and experiencing presents a great opportunity for teaching them about the world outside of themselves.
Yeah.
And then, of course, obviously, having those conversations of, but the Lord is sovereign over all of this, including over a virus. And so we take that into our prayer time of how can we pray for grandma? How can we pray for? So my mom is actually on the front line. She's a respiratory therapist working in a Middle Tennessee hospital. So praying very specifically for her by name and her team by name.
Mm.
I think it represents a great opportunity to teach our children the power of prayer as well, and really leaning into the Lord in a time when things might be a little bit scary.
Yeah. I can appreciate that. And I think all of us that are parents, no matter where we are in this journey, know that we really don't want our kids to go through this without learning all that God, has in mind, and what it means to trust him in some really difficult circumstance, and to sacrifice, on behalf of others. And there may be more sacrifice ahead. I'm sure there will be. Economically, things will shift around a little bit, and we'll all have to make some adjustments and care for each other. And so our kids walking through that with us, I think, I know God can use it in a great way. And it could be the kind of reset that would really change an entire generation, I think.
I agree.
Yeah.
I agree.
Well, hey, let me kind of land this plane this way, and you've alluded to some of it already. And I know you're not a futurist, and I know, we all have limitations. But what are some things that you've seen in terms of the habits that we have had to change in this interim time? We think that may carry over, and that would really be beneficial as we think about the years ahead. What are some resets in our own lives do you think that might be helpful?
Yeah. And that's a conversation that my husband and I and even friends really have. And I've seen it floating around on social media, right? That we hope when we come out of this, or the social distancing rules are kind of loosened, that we don't lose some of these things that we've kind of rediscovered. I've heard a lot of talk about family around the dinner table, and that was something that, while not totally extinct, was a little more rare
Yeah.
than it was when I was growing up, and definitely when my mom was growing up. And it's been true for our family too. We cook every night, which is a little bit of a paradigm shift for our family.
Yeah.
It's a new
That's great.
experience, but it's been wonderful, and it's presented a great opportunity to teach our daughter to cook and to clean, and all the pieces that go along with that. So I think definitely the focus on family that has come as part of this, really, that we have gotten a lot of time together, right?
Yeah.
Probably more than we've had in the past few years. And so hopefully that's strengthening family and core relationships. And so continuing to walk in those habits of time together, time with the Lord. Hopefully this has allowed people, we're not sitting in traffic anymore to get to work. So we have some extra time in the morning
Yeah.
that we can spend, with the Lord, and hopefully those habits will remain, that or our quiet time gets stronger, right?
Yeah.
At least that's the goal. Yeah.
Yeah.
And then so continued focus on family. I love, as someone who works day in and day out with vulnerable populations, I love the focus that's on them right now, and I would hope to see that continue. I would hope that question of how can we serve the chronically ill,
Mm.
the disabled, and the elderly, and kids. We talked about foster care, but how can we serve those vulnerable populations? I'd love for that question to stay on the forefront even after this is over. And so I think really, those are the habits that I would hope, and
Yeah.
the things that we're seeing kind of change. And washing our hands. I mean, if we could all just
Yeah.
continue to wash our hands.
Keep our hands out of our face
That's
and
right.
wash our
Don't touch your
hands often.
nose.
Yeah, right.
Yes. Yeah.
And now all I want to do is scratch my face, and
That's right.
so that's all I think about. But well, Kellsi, thank you so much for what you do, how you and Colby live out your life, and again, the example you are for all of us in terms of loving the vulnerable, whether that's foster kids that are young, or as you work with the elderly population across the state and help them get the resourcing and health care that they need. We're just really grateful for the way that you and Colby both love Jesus and follow him. And it means a lot to our church family, and it means a lot to the greater community. The thing that this is, again, there's a lot of good lessons that come out of this, but one of the things that's been helpful is that it's a reminder that we're all in this together.
That's
And
right.
that whether you're in healthcare or education or the nonprofit sector or first responders, the business community, certainly with the economic impact, that we're all in this together. And it'll take a community that's strong and neighbors that love each other for us to care for one another well. So anyway, thanks for joining me today, and thanks for all you're doing.
Absolutely. Thank you.
All right.